Today we are here to go over test results for Anna and see if she still meets criteria for special services. Students like Anna who have higher needs require more evaluations. Anna is a 10-year-old girl who has been diagnosed with Down syndrome and the youngest of three children. The primary language spoken in the home is English. Anna wears glasses. Anna has a sister who is 18 and a brother who is 15. Her brother has ADD and he receives resource minutes for math problem solving. Anna lives with her mom and dad. Her mom is a special education teacher for students with special needs and her dad works as well. Anna was born at 36 weeks via C-section, coming into the world at 7 pounds. Up till 36 weeks, there had been no problems with her development. At 2 days old, she was rushed to the local NICU. There the doctors found Anna had two small holes in her heart. She had one large hole between the upper chambers and a small hole between the lower chambers. Because of an aneurysm above the large hole, they dangled down over the hole, keeping pressure on her heart. Kept her stable. She did not need surgery. At the age of 2, the aneurysm reached the other side of the hole and attached to the wall, forming a new wall. The other hole closed on its own. Other than a slight murmur, her heart is otherwise perfect. Overall, Anna has been relatively healthy. Anna has problems with muscle tendon weakness and weak muscle tone. Anna started receiving services at the age of 2 months through First Steps. In 2013, Anna met eligibility as a young child with developmental delays in the areas of communication and physical delays on 5/2/13. They provide Anna with OT, PT, speech, and developmental services. At 3 years of age, Anna started school at Early Childhood Special Education under YCDD. During that time, at the ECSE, she received occupational therapy, physical therapy, and speech services. Anna's parents decided to wait an extra year between ECSE and kindergarten to give her more time to mature. She is now in 4th grade and she gets instruction for math and comm arts and an ID classroom. She goes to science and social studies and specials with other students. Anna currently receives 600 minutes per week of specialized instruction in literacy skills, 200 minutes per week in functional math skills, 50 minutes per week in behavior skills, and 200 minutes per week in independent living skills. According to her most recent evaluation done on 11/19/16, there was a change in eligibility from YCDD, areas of communication and physical, to intellectual disability. Anna continues to receive 30 minutes a week of PT and OT and 23 minutes weekly in speech services. In PT, she is working on gross motor skills. Anna is able to copy horizontal vertical lines and circles of endpoints, and she cannot copy a cross, X, square, triangle, or first name. Most of the time she uses her left hand. She can stack blocks but struggles with buttons, zippers, and snaps, lacing cards, and string beads. Anna has decreased upper extremity core strength and has some gravitational insecurities and lack of awareness. Anna was given the Oral and Written Language Skills 2nd Edition OWLS 2. This test was given on 9/23/16. The Oral and Written Language Skills 2nd Edition is a set of 4 interrelated skills that together provide a comprehensive assessment of language. The OWLS 2 skills: listening comprehension, oral expression, reading comprehension, and written expression enable assessment of oral language skills for ages 3 to 21 and written language skills for ages 5 to 21. Anna's oral language composite standard score of 51 falls below the normal limits for her age. The results indicate difficulties in answering questions and negative. Strengths were noted when she's counting, stating colors, and concept. Anna was given an informal language sample. The language sample was taken by a speech therapist to assess language functioning in natural communication setting on 9/30/16. The language sample was collected during an unstructured activity. The language sample was collected in a speech room, elementary school, with a student evaluator and an evaluator present. An ongoing analysis was collected. Description of the child's language deficits identified by a sample during an instructed activity in a speech room. Anna used mainly 2 to 3 word utterances. She initiated conversations, however, had difficulty maintaining and ending a conversation. She had difficulty conveying her thoughts meaningfully into conversation. She had difficulty answering and asking simple questions. Anna demonstrated understanding and used some basic concepts. She used simple, descriptive words and answered yes and no questions. She used regular plurals, some pronouns, and possessive. She also had difficulty using to be verbs and following simple directions. Overall, language skills in informal contexts appeared to be commensurate with formal testing. Anna was given the preschool language skill 5, PLS 5, given a 9/29/16. The PLS 5 is an individually administered test used to identify children who have a language disorder or delay. The test is designed for children from birth to 6 years. Standard scores, percentile ranks, and age equivalents are provided for all individuals who are functioning within a designated age range. Anna's total language score of 63 fell below normal limits for her age. He uses present progressive verbs, possessive names, categories, and identified rhyming words. Difficulties were noted when answering questions, stating an object is used, completing analogies, and understanding concepts. Anna was given the Whistler Nonverbal Scale of Ability, WNB, on 10/25/16. WMB is an individually administered clinical instrument designed to measure the general cognitive ability of examinees ages 0 months to 21 11 months using multi-subtest comprehensive format that eliminates or minimizes verbal content. The WNB is comprised of 6 subtests with separate versions for ages 4 to 7 and 8 to 21, consisting of 4 and 2 subtest batteries for each age group. Anna demonstrated adequate skills in following simple, basic oral and visual directions. She was able to follow basic oral commands accurately, was able to observe basic visual stimuli, interpret visual stimuli, and have good attention to auditory stimuli, was also good until she became very weary and focused. When she lost focus, her attention for both visual and auditory diminished significantly. Anna demonstrated good basic skills for following directions, listening carefully, observing a visual stimuli, repeated the visual stimuli patterns, and followed the basic oral directions. Anna did her best job when there were both visual and auditory verbal cues for directions. At the chronicle age of 6 months, Anna achieved a full scale of 62 on the WNB. Her overall level ability was ranked at first percentile, was within an extremely low range compared to other students her age. Anna's ability of subtest area recognition and relative strength for her recognition involved viewing visual stimulus and being able to pick stimulus from array of stimuli presented seconds later. Similarly, coding represents Anna's lowest score. Coding involves graphomotor speed, use of pair symbols, and simple geometric shapes at a specific time. Based on her full scale 62, a standard of 40 below, and achievement assessment suggests the presence of significant discrepancy between ability and achievement. Anna was given the Adaptive Behavior Assessment System Second Edition, ABAS-2. ABAS-2 provides a comprehensive non-reference assessment of adaptive skills for individuals aged birth to 89 years on 10/21/16. It measures skills that are important to everyday life, focus on 3 adaptive domains: conceptual, practical, and social skills. Scores in areas that combine to provide a comprehensive estimate of individuals' adaptabilities referred to as a General Adaptive Composite GAC score. The GAC score describes the degrees to which individuals adapt skills generally compared to adaptive skills of others. Anna was rated by her parents. She attained a score of 83. Anna was rated by a special education teacher with the following results. On this rating, Anna obtained a score of 56 on GAC. Her true score is likely to fall within the range of 54 to 58% and 90% accuracy. Anna was also rated by her general education teacher. Anna obtained a score of 57 on their GAC. Comparison of the 3 ratings. GAC composite scores. The 3 separate domains were very similar. The parents' results indicate elevated scores in comparison to teacher ratings. The social domain was a definite strength, while the practical domain was a weakness. Anna was given the Young Children's Achievement Test, YCAT. This is a measure of achievement levels of children in preschool, kindergarten, and first grade, designed to be used with children between the ages of 4 and 0 months, 7 and 11 months. YCAT includes 5 subtests: general information, reading, mathematics, written and spoken language. The test yielded substandard test standards and an overall composite score derived from 5 subtests. The YCAT was administered to Anna on 10/25/16. At the chronological age of 4 months, Anna earned an early achievement composite score of 60, indicating her overall level of academic skills can be described as a very poor range. General information score of 79 indicates her overall comprehension, common knowledge, and concepts in poor range. This was her highest academic score and reflects an area of strength. Based on a reading score of 72 and his knowledge of measuring printed symbols, alphabet, conversation, and print within the poor range. Her mathematics score of 70 places her understanding of math concepts as counting, ordinal positioning, relative magnitude, time, money, and problem solving in poor range. Based on a writing score of 70, Anna scored a poor range of area knowledge about writing, the use of writing, the tools of writing, the ability to copy, to write alphabet, to write its own name, and write elementary words and sentences. Anna spoke language score of 64, in which case her knowledge of perceptive, expressive, vocabulary, syntax, communication skills. This presents the lowest academic and flex area weakness. Anna's scores of YCAT show a fairly consistent profile for each academic area. Spoken language score is somewhat lower than other scores. General knowledge is higher. Scores from 64 to 79. When compared with Anna's ability to score a 62, her achievement scores are appropriate. Looking at all the information, Anna still meets the criteria for a child with intellectual disability, which negatively impacts her ability to function in a school environment without significant support. She requires specialized instruction, accommodations, modifications provided by a special education teacher in all areas, in general curriculum, and the area of adapting a function.